Hi, today we'll discuss about MCQs on antibiotic, antifungal, and anti-cancer drugs. So the first question is, which of the following antibiotics contains a beta-lactam ring in their chemical structure? Option A, penicillins. Option B, cephalosporins. Option C, carbapenems and monobactams. And option D, all groups. This is relatively easy questions, I think. Beta lactam group is present. Answer is all groups. All these groups are containing beta lactam ring. Next question. Tick the drug belonging to antibiotics monobactams. Option A, ampicillin. B, bacillin 5. Option C, aztreonam. Option D, imipenem. Antibiotic monobactam is commercially available as, answer is aztreonam. Option C is the answer. Option C. Next question. Which of the following is associated with neutropenia? Neutropenia is much more common in case of chemotherapy. So which chemotherapeutic drug responsible for neutropenia more among these options? Option A is doxorubicin. Option B, vincristine. Option C, cisplatin. Option D, methotrexate. Answer is methotrexate. Methotrexate, cyclophosphamide, these drugs are associated with severe neutropenia. Next question. A diabetic patient developed cellulitis due to Staphylococcus aureus, which was found to be methicillin resistant. All of the following antibiotics will be appropriate except option A, vancomycin. Option B, imipenem. Option C, teicoplanin. Option D, linezolid. So answer is imipenem. Carbapenem group of drugs, imipenem, that is not effective in methicillin resistant drug. Next question. Which of the following antibiotic is not used in the treatment of infectious mononucleosis? This is a very important question. Which antibiotic is not used in the treatment of infectious mononucleosis? Option A, penicillin. Option B, gentamicin. Option A, ampicillin. Option B, gentamicin. Option C, erythromycin. Option D, ciprofloxacin. Answer is ampicillin. Ampicillin, you have to understand that antibiotic is not the treatment of infectious mononucleosis. So the formation of this question is wrong. Antibiotic is not infectious mononucleosis is responsible for the virus, Epstein-Barr virus. So antibiotic is not the drug of choice. But sometime in case of superinfection or any other comorbid infectious disease, if we use antibiotic but the patient is having infectious mononucleosis, we will avoid ampicillin, because ampicillin in infectious mononucleosis patient, it causes maculopapular rash. Maculopapular rash. This is the example of drug induced, ampicillin induced maculopapular rash that is distributed throughout the body in case of infectious mononucleosis patient. Now, isoniazid induced neuropathy is treated with thiamine, pyridoxine, niacin, riboflavin. Isoniazid is responsible for the deficiency of, it is actually anti-tubercular drug, but INH when taken, it causes deficiency of pyridoxine, as because it interferes the metabolism of pyridoxine. So always pyridoxine should be supplemented along with INH. So this neuropathy treated with answer pyridoxine. Next question. Concurrent administration of tetracycline is most likely to impair the action of. It's a logical question actually. Option A lincomycin, option B chloramphenicol, option C erythromycin, option D penicillin. We will not use which antibiotic along with tetracycline and why? Answer is penicillin, because penicillin is a bactericidal drug. Penicillin is bactericidal drug. All other drugs, tetracycline, linco, chloramphenicol and erythro, they are bacteriostatic drug. We never combine bacteriostatic with bactericidal. So the answer is penicillin. Which drug causes photosensitivity? Which drug's adverse reaction is photosensitivity? Tetracycline, aminoglycosides, penicillins, cephalosporins. Answer is tetracycline. Option A. Tetracycline is responsible for photosensitivity of many patients. Even doxycycline, I have encountered a patient who is suffering from photosensitivity due to doxycycline medicine's adverse effects. So next question. Will a 14 years old boy develops a bad case of otitis media a few days after swimming in Hideaway Lake, MS? Will's previous medical history is unremarkable except for having had a minor skin rash 2 years ago after being treated with amoxicillin for a sore throat. Which of the following shares a common mechanism but would be very unlikely to produce a similar allergic reaction, as for example 1 to 2% or lower chance? Option A ampicillin, B cefaclor, option C clarithromycin, option D clindamycin, option E gentamicin. So you have to find the answer whose mechanism of action same as amoxicillin, but it will not create similar allergic reaction. Patient was having minor skin rash when treated with amoxicillin. Which drug's action is similar, but the side effect of this minor skin rash is lower chance? Answer is cefaclor. Cefaclor's action, it shares the common mechanism, but its chance of getting skin rash with this drug is very low because its structure is different than penicillin. But one thing you have to remember, in case of anaphylactic reaction, if there is any history of anaphylactic reaction with penicillin drug, amoxicillin or ampicillin, cefaclor or cephalosporin group of drug is not indicated, contraindicated. But in case of minor skin rash, we can give cefaclor. So next question. One of the most challenging types of infection to treat are those produced by gram-negative enteric bacteria that produce extended spectrum beta-lactamase, ESBLs. Which type of beta-lactam drug is structurally different enough to other beta-lactams to remain effective in treating most infections caused by this type of bacteria? Option A carbapenems, option B extended spectrum penicillins, option C fourth generation cephalosporins, option D monobactams, and E narrow spectrum penicillins. Answer of this question is option A carbapenems. A 47-year-old patient with a severe bacterial infection is given a drug by IV infusion. Because the drug is administered too rapidly, the patient develops hypotension as well as marked flushing and itching over the upper portion of his chest, neck and face. The antibiotic most likely responsible for producing this reaction. Option A, amoxicillin, aztreonam, daptomycin, linezolid, vancomycin. You have to find which drug's adverse reaction is flushing and itching over upper portion of the chest, neck and face. Answer is vancomycin. We have discussed about red neck syndrome last video. Vancomycins often create these problems, this problem of rash or flushing neck, face and the upper torso. So the answer is vancomycin. It's because of red neck syndrome. Next is antibiotics clearance from the body most likely influenced by severe hepatic disease. Option A, penicillins, clindamycin, rifampicin, B and C. Which antibiotics clearance will get affected by severe hepatic disease? Penicillins, clindamycin, rifampicin, both B and C. Answer is rifampicin. Its half-life will get prolonged. Okay, rifampicins half-life prolonged in case of severe hepatic disease. The answer is rifampicin. Next question. Antibacterials regarded as generally safe to prescribe in pregnancy. Erythromycin, cephalosporin, tetracyclines, A and B. You know tetracycline is not safe for pregnancy as because of it will create fatty liver, and one thing more. I'm not remembering this thing right now. Answer is D, A and B. Erythromycin and cephalosporin is safe. Erythromycin and cephalosporin. Answer is D. Next question is, what antifungals are used to treat cryptococcal meningitis? Cryptococcal meningitis. Option A, 5-fluorocytosine. Option B, amphotericin B and 5-fluorocytosine. C, 5-fluorocytosine and triazole. Option D, triazole. Answer is Answer is amphotericin B and 5-fluorocytosine. Now, terbinafine is an example of which class of antifungal? This is actually, terbinafine is a new type of drug. This is a new type of antifungal drug. Which class of antifungal? This is which type of antifungal? Polyene, antimetabolite, azole or lilamine? Answer is D, lilamine. For drugs would you administer for a patient with tinea capitis? That is a fungal infection of the scalp. Clotrimazole topical, clotrimazole oral, amphotericin B IV and terbinafine oral. Which drug you prefer in case of tinea capitis? Is it clotrimazole topical or this is oral or amphotericin B or terbinafine? Answer is D, terbinafine. Next, which of the following is true of 5-fluorocytosine mechanism of action? Option A, it inhibits DNA synthesis. Option B, it is converted into 5-fluorouracil which is incorporated into fungal RNA. Option C, it inhibits protein synthesis. Option D, all of the above. What is the mechanism of action of this anti-cancer drug? This is antifungal. Will it inhibit DNA synthesis or it converts into 5-fluorouracil which incorporated into fungal RNA? It inhibits protein synthesis. Answer is D, all of the above. Alopecia have poor activity against Cryptococcus, dermatophytes, Aspergillus, Candida. So which fungal species is not sensitive to terbinafine or alopecia group of drug? Crypto, dermatophytes, Aspergillus or Candida? Answer is D, Candida species. The client with non-Hodgkin's lymphoma is being managed with vincristine. Which of the following indicates a side effect specific to this medication? Alopecia, numbness in the toe, chest heaviness, weight gain. This is a memory-based question actually. You have to know the side effect of vincristine, then only you can understand. You can write this answer. Alopecia, numbness in the toe, chest heaviness, weight gain. The answer is numbness in the toe. Numbness in the toe. Which of the following is the hormonal agent used as a chemotherapy of breast cancer? Tamoxifen citrate, ifosfamide, option C, carmustine, option D, methotrexate. Which chemotherapeutic drug used in breast cancer or hormonal agent? Answer is tamoxifen citrate. Now today's last question. The nitrogen mustard with the broadest spectrum of anti-tumor activity in its class is ifosfamide, cyclophosphamide, meclorethamine, and option D, chlorambucil. Which nitrogen mustard group of drug presents with broadest spectrum of anti-tumor activity? Answer is option B, cyclophosphamide. Cyclophosphamide. So this was today's discussion. We'll meet in next video. Thank you very much.